Good evening, everybody, and a very warm welcome to Japan House London. My name's Sam Thorne, Director General here, and it's really a pleasure to be introducing this evening's event, Exploring AI Applications in Health. We're delighted to be partnering once again with the Tony Blair Institute for Global Change. Before I introduce the chair of this evening's event, I'll just say a few words about Japan House London. We opened back in 2018. We have a mission to present the very best of Japan here in London. We have an exhibition space, a beautiful show on at the moment of craft called Hyako that runs for another couple of months. Do come back if you have the opportunity. We have a shop, we have a restaurant, we have this event space which has a very busy program of film screenings, talks, hands-on workshops and many other things besides. It's great to have you here. Welcome, and welcome to everybody who's joining online. I'm going to pass over now to Ned Naylor from the TBI, who's going to introduce some of the themes that this evening's distinguished panel are going to be touching on, and then introducing the panelists too. Without further ado, please join me in welcoming Ned. Thank you so much.
Thank you, Sam. And just to reiterate, welcome to everyone that's here, both in the room and online, and many thanks to Japan House for hosting us in this fantastic venue this evening. We're joined by a fantastic panel tonight. So first, Ben Maritapu, who is the CEO and founder of Sera, and then some people I work closely with at TBI in a late change to some of the people that were advertised. So we have Barbara Baldi and Kengo Shibata, who are uniquely placed, along with Ben, to speak about the topic that we're covering tonight. My name is Ned Naylor. As Sam said, I lead our health advisory work at the Tony Blair Institute, and Becky and Ren, who were due to be joining us but have been unable to, send their apologies. I'll let the panelists introduce themselves fully in a couple of minutes. But before I do that, and before we come onto the stage, I want to just show a few slides to talk through some of the background, some of the context for what we're talking about this evening. So as you know, what we're talking about at a high level is AI applications in health for aging populations. But I want to look first at some demographics for Japan. So this is looking at Japan's population pyramid for the year 2000, 26 years ago. And here you can see there are two bulges, both of working age, but at different stages in their lives. As we move forward to 2020, just a few years ago, you can see both of those groups aging. And then as we move forward another 20 years to 2040, you can see that actually the largest bulk of Japan's population will sit over 60, getting to the end of their working lives. And for the first time, we'll have a population that is in some ways defined by its elderly. And we'll need to think about, as a society, how we can deal with the needs, how we can provide for the needs of those people. The UK is not quite at the same place yet, but it is not far behind. Looking at the line on this page, you can see that the UK population is about 20% over 65 at the moment, and that is gradually but unstoppingly increasing over coming years. Now, what will the impact of that be? Well, both countries will feel the pressure on their health and care systems, and I think that's undeniable. As people get older, they have, as we all know, greater health and care needs, and our health systems will need to provide for those. To give a couple of statistics to illustrate that, in Japan, nearly half of health insurance funds go to seniors already. And if you look at the UK's NHS workforce plan, or England's NHS workforce plan, the projections show that in 10 years, 1 in 11 workers in England could be NHS staff. There was an article in the FT a couple of weeks ago that talked about a national health state with government spending on health matching the amount that's spent on the next 5 government departments combined. And this isn't just impacting our health systems, the way we run our public services. It's also impacting people's experience of care. There was a sobering statistic from Age UK research that came out recently that said that more than 1 million older people faced 12-hour or longer waits in A&Es around the country. And that clearly has a huge impact on those individuals and their families. Now, this affects the UK and Japan, as I've said, and you've seen the statistics. But it will also become a defining global issue, looking at other high-income countries, but also across the income spectrum. More societies are getting older and older. And by 2030, 1 in 6 people in the world will be aged 60 years or older, and that number will only increase. With this, governments will be faced with a dilemma. And in some ways, mathematically, they have 3 choices as the population's needs for health and care increase. One is to increase funding, to increase that proportion of government expenditure that goes to health and care. That won't be sustainable forever, though, without impacting other public services. And in the end, taxes would have to rise. And there's not a great deal of political or public appetite for that. The second option is to hold spending the same, to carry on delivering services in the way that we do currently, and to watch quality of services decline. And you could argue that that's something that's happening in some countries at the moment. The third option, and this is what we'll talk about today, and it's by far the most appealing option, is that instead of taking one of those first 2, what we try to do is to get more for every pound, every dollar, every yen that we put into our health and care systems. And we do that by innovating and providing care in a different way. And what we will be talking about this evening is whether AI can help us with that, whether it can be something that helps us make our health and care systems sustainable for the future in the face of ever-increasing need from the demographic change that we've been talking about over the last couple of minutes. Now, what's fantastic is that Japan and the UK are well placed to lead some of this innovation in AI. Japan is one of the few countries in the world that has laid out in Society 5.0, something we'll hear about a bit more as we have the conversation, a vision for what the future can look like in the age of AI at a society-wide level. And the UK, as we know, is somewhere which is well known for its basic AI research and also for its startups. And we'll hear from the founder of one of those in a couple of minutes. There are, and we could have listed many, many things on these slides, but there are an increasing number of incredible applications of AI that really are changing the way that care is delivered, and robotics as well. So robots in Japan that can help deal with elderly people's care needs, analysis of CCTV to identify dementia and abnormal gaits, abnormal ways of walking. So there's potential here, but what we're going to try to answer today is 3 questions, and the first of those is on the slide. So do we believe all this? Can AI help us solve this problem that I've presented? Or is it hype? Can AI deliver the transformation our health systems need to support aging populations? Alongside other things, of course. And then once we've talked about the answer to that question, then the next question is how? And to put that more specifically, what can we practically do? What can people practically do as leaders in the private sector, leaders in the public sector, governments and others, to try to make that change happen and allow AI to fulfill that potential if we believe that potential is there? That's all I'm going to say. So what we're going to do now is get some chairs on the stage and get the speakers up, and we'll start having a conversation with them. Thanks, everyone. Thank you, everyone, for joining me, Ben, Barbara, Kengo. What I'm going to ask you to do in turn first is to briefly introduce yourselves. I know I've only given a very brief headline of who you are. And then, once you've done that, to answer in a sentence or two, when we think about caring for the elderly in 10 years' time, will AI be playing a major role, or are we expecting too much of it? And I'll go Ben, Barbara, and then Kengo. Ben.
Great. So Ned, thanks for inviting me to be here. And it's a very important topic given, I think, many societies, but in particular for Japan and the UK, how we care for an aging population sustainably is a critical priority. So my name is Ben, I'm founder and CEO of Sera. We are Europe's largest health technology company. We focus on taking healthcare from hospital to home using AI and software that we built. Just to paint a picture, so at the moment, our carers and nurses every month deliver around 2.5 million visits to people in their homes. That's equivalent in scale to all NHS A&Es nationally. We've built AI tools that allow us to cut hospitalizations by around half, which I can talk about a bit later. And we're also pioneering the use of robots in care as well. To your question, I think that AI is already having a critical role in the care sector, but only some parts. The care sector has unfortunately lagged when it comes to technology adoption compared to almost every other sector and industry, even compared to hospitals and primary care. There are home care businesses I visit even now who are still using fax machines. So talking about AI is quite a distant future. And so I think the AI, even to improve care, to improve health outcomes, to improve how we staff care, is available now, actually, in some cases, but the adoption is a real challenge. And I think that's where a lot of policy focus needs to focus.
Thank you, Ben. And I look forward to, well, both welcome again, and I look forward to exploring that more as we go through the conversation. So Barbara, over to you.
Thank you, Ned. Hi, everyone. So I'm the Senior Director for Government Innovation and AI at TPI, leading all the work on advisory services on tech in governments with all the governments we work with worldwide. And prior to that, as you know, Ned, I was for 24 years in international organizations, the UN and the OECD, working on digital transformation, including trying to help governments understand how to use technology and AI to deliver better services, including in health. There are some governments that since a few years ago, when they were designing digital strategies, for example, the Nordics, were already thinking about, placing health at the core. They had digital welfare systems with, the forward-looking strategic view of the patients of yesterday and the patients of tomorrow, which brings me to your question on, is AI having a transformative impact? Yes, I agree with Ben that if governments had done if higher number of governments had done what few governments had been doing since 10 years ago, probably we would have had a more transformative impact already. It can change how governments understand the patient, the human, the final user of the service. It can help the government understand how to provide a service. What does that service needs to look like because of the need has changed. And third, it can help improve the quality of that service and make the work of the workforce more productive. So I'm sure we'll be talking more about that, but definitely it can and it should have had a much even stronger transformative impact already.
Thank you, Barbara. Kengo.
Hi, so my name is Kengo Shibata. I am in the Science and Technology Policy team at the Tony Blair Institute, and I focus on emerging technologies and policies around them, particularly around AI, but also quantum and neurotechnologies. And I'm interested in how sort of innovation policies can help shape the way in which we interact with technology and how they can be used in societies and how we can sort of engage with them in the most sort of appropriate ways. In addition to this work, I'm also a venture partner to a Japanese deep tech fund called UTech, University of Tokyo Edge Capital Partners. And this is a VC that invests in early stages of companies in Japan, but also globally, including the UK. And as for background, I am trained as a clinical neuroscientist, and in my PhD, I was investigating how we can better understand mechanisms of learning and memory in aging populations, and also in neurodegenerative disorders like Alzheimer's and Parkinson's. And to your question on how AI will look like and healthcare will look like in 10 years, I do think that AI will transform how care will be done for the elderly. I think this will also come in a combination of how we collect and use data, and I think for that we will need to be building public trust so that we have faith in the data we're giving and how it's used, and also how we think about regulation and governance to really have a system that works and people are happy to use.
Thank you, Kengo, and look forward to exploring all of that more. Ben, I'm going to come back to you and dig a bit deeper into what you were saying. Clearly, the impacts that you've described, those headline numbers, the number of people, the proportional reductions in hospital admissions and so on are hugely impressive. And it's clear that you are deploying AI and robots every day to facilitate care for elderly people, presumably as we speak. You are doing that. Can you give us an example of where it's kind of practically delivering measurable value, both in the numbers but also for the people who it's serving?
Yeah, of course. And let me tell you about an experience I had when I used to practice as a doctor, which is what I did before building Sera, and how that experience motivated me to use AI in health and care. So I was practicing in A&E, actually in a hospital quite near to where we are now, and there was this older gentleman who would come in and out every few weeks, and he was receiving care at home, typically with a urine infection. And in one instance, he presented to A&E a bit later than he had in past instances, and the infection had unfortunately started to spread around his body. And we gave him very strong antibiotics and fluids, but sadly, that just wasn't enough. And he ended up passing away. And that was a real tragedy. And for him, his family members, for the carer who was looking after him, because if that infection was picked up a bit earlier in the community, actually urine infection you can treat with antibiotics, it's not that hard, and it's not expensive. So it was really sad, but it showed me that the potential to try and spot health issues early, and if that can be done simply and effectively, it could have a literally life-changing impact on people every day in this country who are going in and out of A&E. And so when I started building Sera, where we organised for carers to look after people in the home, very similar, but we'd built software, we, at almost the first instance we could, started taking the data from these visits, where our carers visit someone, they log on our app, if that individual has some symptoms, what they're eating and drinking, what medications they're taking. And we started to apply algorithms to that data, machine learning algorithms. And quite quickly we realized we could predict with very high accuracy if someone was likely to become unwell before they did, and with around 80% accuracy if they were likely to end up in hospital 7 days later. And so on actually the first day we rolled it out, it spotted someone who was at high risk of having a urine infection, and the carer that day went to get antibiotics for that person after consulting the GP, and then that person started on antibiotics and they got better a couple of days later. And so that, I think, a simple but very life-changing way in which a type of AI, which in this case is machine learning, can make a difference to people's lives. Using it to spot trends in their health, spot health issues early, flag that for intervention, do something about it, and reduce that hospitalization risk, which now, on average, we're reducing hospitalizations by over half for the people that we serve. And that's important because we look after mainly older, vulnerable people with multiple health conditions. Every year, on average, without our technology and our model, they would end up in hospital 8 times a year, which is an awful lot. And we get that down to more like 3 times. But those algorithms we launched 6 years ago. Now, this is before ChatGPT came out and LLMs were such a major trend. Now, the prospect and potential for AI and what it can do is just much further than what I thought could even have imagined back in 2020.
Thank you. And those are amazing stories, and it's inspiring hearing the kind of the journey from that tragedy, to be honest, to that impact for people, keeping them well and keeping them out of hospital. I guess so. Clearly, the implementation of technology is both about the technology and the implementation, right? You referenced before that kind of getting that adoption is one of the most difficult things to achieve. How much, with a significant workforce working at Sera, how have you managed to work with the human factors that are required to prompt technology adoption?
So it's a critical priority, and I really mean that. I think that, number one, focusing on user experience of our staff, how they interact with the technology, ensuring they don't just see it as a nice to have, but it is a must have. It makes a real tangible difference to their day, to their work schedule, makes it easier, has meant that adoption is much greater. I mean, when I used to practice as a doctor, we'd get new things being rolled out, but it didn't make a difference to my shift. Yep. If anything, it was another thing to think about on top of a really busy schedule. So we've tried to build solutions that just remove some of that friction. And therefore, with the first few interventions we rolled out, people thought, oh, wow, this is actually pretty good, which means the subsequent innovations are easier to adopt. I think so that's been one real learning and focus, user experience, particularly frontline staff. The second is, healthcare is multi-stakeholder, right? It's not like the other ways in which we interact with technology, whether it's our banking app or our food delivery app or ride sharing or using our smartphone. Because in all those companies, there's a much more direct relationship between the person who's adopting the software, the person who's paying for it, the person who's designing it. There's a much tighter loop. Whereas in healthcare, you have many different stakeholders. The person who's using it may not be the person who's paying for it. That could be the NHS or the government or a different payer, who's different from the person who's administering it, which could be the nurse or the doctor or the healthcare professional, who's different from the person who's regulating it, if there is a regulator in other sectors. That multi-stakeholder nature means that it's harder to get adoption in healthcare. And so it means that when one is building AI or software, you need to think about the use cases and the benefits for those stakeholders and ensure they're aligned early on, so the regulator or the payer or the healthcare professional think, oh, this is actually beneficial to me. I'm going to help it in being adopted.
Thanks, Ben. And just before I move on to Barbara, you've referenced the NHS and government. How has interacting with them been as you've built your company? What could they do to make it easier to bring some of these kind of technologies to benefit people?
So when I think about at a sector level, and this applies for the UK, Japan, many health systems, what some of the points are that decelerate adoption, I think, and what policymakers can really change. I look at it really through two lenses. One is reimbursement and the other is regulation. Reimbursement, so I'll give you a very day-to-day example from the care sector. We provide care in people's homes. We're reimbursed by local authorities and the NHS per hour of care delivered, and sometimes per minute. 30 minutes of care does not necessarily correlate with high quality care or better outcomes or preventing someone from having a fall, helping them recover. And so that misalignment in incentives already at a very granular level, that's how I would say almost all care in this country is paid for by the state, means that there's very little motivation to adopt tools that improve health outcomes by care providers, care organizations, care companies. And so changing those incentives so that they're more in line with the people receiving care, but they're also more in line with the pressures systems are facing nationally, whether it's cost pressures or waiting lists. Aligning those incentives, I think, will allow for better adoption of technologies that help tackle those challenges. And then regulation. So the first time we had our CQC inspection, which is a number of years ago now, in London, the inspector said, so where are the filing cabinets? That was one of the first questions they asked. Yeah. And so when a regulator is thinking in that way, they're not encouraging adoption of technology. And when we say, oh, we've got it all digitally, oh, digitally, what do you mean? Why are you doing that? We need to see the paper files. Where are the ring binders? That is not encouraging technology and transformation. And so the regulator also has a very powerful role to play in encouraging care providers in thinking about the latest technology that improves healthcare outcomes, which in turn will benefit the people receiving care.
Thank you, Ben. And it's something perhaps we can touch on as we go through this point, that how regulators can keep up with very rapid change, and that we don't end up regulating what we were trying to regulate 10 years ago, and in fact facilitate that innovation in a robust way, of course. So Barbara, I'm going to turn to you. You've worked with governments around the world to help them adopt digital tools, adopt technology. What can we learn from other sectors when we think about AI in health?
So first of all, I think the main point is that it's not a tech issue, it's not a tech problem, but it's a government delivery matter. Like Ben said, when you think about using tech to deliver better value to the people, it's about better services, better user experience. So it's not only about looking for efficiency, but looking for better quality of the end result. I remember a few years ago when working with Spain in the e-health domain area, their priority was to ensure that the experience of any Spaniard walking through or traveling through the country would be the same, even if having a strong local autonomy, the quality of, in theory, the quality of health could be very different across the country. by introducing the electronic health record, for them the purpose was not necessarily to make the practitioners more efficient, but it was to improve the experience that any Spaniard could have when traveling across the country. Having access to healthcare, especially for people with chronic diseases, for them was a priority. So if we think about aging as an issue, that's not unique to Japan and the UK. I'm Italian, and if you look at data in 2025, 300,000 babies were born in a country with 61 million inhabitants. You can make the math, but clearly the fertility rate is not high and has been declining for the past decades, and I don't think it's going to change. So if you look at some of the common problems, and going back to the matter that is a government delivery issue, it's not a technology issue, there are three main, I think, characteristics that cut across all aging systems. Number one, a higher number of chronic diseases. Number two, higher demand of home care support. And third, workforce gaps. AI, in simple terms, and without getting into the technicalities of it, can really help. First of all, with predict prevention, right? So if you can predict earlier who's going to get sick, maybe you can provide a better service. Second, if you can use AI to make homes safer with sensor detection, with remote assistance, with the possibility for people to intervene faster if there's a problem. And third, if you can ensure that AI is used to make the workforce more productive, but also to reduce, for example, hospital admissions, then you can make sure that the whole system becomes more capable to deliver a better user experience.
That makes sense, thank you. I guess as a follow-up to that, in health we sometimes think of ourselves as special, right? It's about human lives and everything else. Should we think about health as different from other sectors, or should we be approaching it in the same way as we're approaching, I don't know, the transport system or the way we run digital ID for a government?
So, working with government, so answering your question from a government perspective, no, it's not different. Because if we go back to the point of being a matter of government delivery, it's always about people, right? So if you use AI or tech to improve transport, to improve education, to provide a digital identity way for people to identify themselves or interact with the public sector more easily, it's always about the human element that you're serving. So what we can learn from other sectors where tech and AI are being used more from governments to deliver better services, there are a few things that I think governments that have been more mature in using tech are teaching us. So first of all, it's about having a clear goal and outcome. So when governments, for example, invest on AI, sometimes it's not clear what they want, and what they want is not aligned with the government priorities. Health, for example, what is the main priority that they're trying to achieve using AI? Target the outcome, target the goal, and have use cases in that sense. I go back to the example of the Scandinavian countries, and in particular Denmark I was providing earlier. They were so clear on their goal that all their policies were aligned on digital government, on health, on welfare. So that was a very strong way to have all the different parts of the administration aligned. To improve investment and funding. Investment within governments is very vertical, is very silo. If you use AI to improve results, you need to have the right investment mechanism in place and spending mechanism in place so that you can cut across the different silo and be able to invest horizontally to target the shared objectives. It's about data. You need to have your data in order. Data needs to be available, data needs to be of good quality, data needs to be shareable across institutions, not only from a technical point of view, but even from a legal point of view. Data needs to be used, like Ben was saying, for the feedback loop mechanism to see what works, what doesn't work, what are the trends, for example. You need to have regulations in place that somehow protect safety, privacy, assurance. You need to have the right workflows in place. So it's about, cutting down the bureaucracy that doesn't help and not transferring online inefficiency that exists offline and in the analog world. And last point is about people. So you need to protect the workforce that is the one that at the end of the day needs to use tech to deliver better results. So these are some of the lessons that I think we can definitely learn from how AI and tech have been used in areas where maybe the use has been a bit more mature.
Thank you, Barbara. Before I move to Kengo, I'm just going to switch tack for a second, because I know you were in Delhi last week at the AI Impact Summit, and I just wondered if there were any themes that came out of the conversation there. Perhaps say a little bit about the summit itself for people in the audience, but any themes that came out that relate to the discussion that we're having today.
Yeah, very interesting, because I would start with the first one, which echoes what Ben was saying, which is around measurable impact. There's still little emphasis on results, benefits, and measuring and monitoring if the use of AI is actually helping governments achieve those benefits, which is essential to be also able to assess if an investment has not been leading to the results that we expect to lead. Second, there's definitely a call to move from pilots and use cases to something which are good to show results and maybe to be agile and experiment and learn, but to create an environment where those pilots can be scaled and things that have been put in place can be reused in other sectors. And then the third point is around sovereignty. We released a paper in TBI a few days ago on what does sovereignty means in the age of AI. And the key message is that the focus should not be for any government on owning all the AI stack, but maybe the emphasis is on the applications to be developed. And that's where I think the value can be delivered, which is context relevant. What matters for AI in health in a country maybe is different from what matters in another country. So I think the emphasis really needs to be on results, applications, use, and trying but replicate what works.
Thank you, Barbara. So Kengo, both the UK and Japan, as we've heard, face aging populations, and yet many AI in health startups that are kind of looking to serve that population, they focus on the US when they're looking to scale. What does that reveal about the strengths and limitations of our domestic health innovation systems?
Yeah, I think that's a very salient question, and there are obviously many reasons why one looks at the US to scale. And actually one of the topics in the India Impact Summit was also that there's a lot of impact that can be done without being at the frontier of AI. And there are places like India, but also Japan, UK, Italy, all across the world that can really benefit from AI. So for it not just focus on the US, but around the world is going to be very important. And obviously, a lot of you will know why the US is attracting. There's a larger market, there's better reimbursement schemes, there's much more talent, capital, and a richer ecosystem. But at the same time, that will probably look beyond the issues of the local needs. You know, if we're talking about Japan and its aging population, we need solutions that are localized to Japan. And it would be a shame if these new technologies are aiming to scale just because investors want a larger return on investment and want to go to the States. And I think for that, we probably need to be thinking about, you know, what are the ecosystems that are supporting local technologies. And I think there probably is a difference between services and technology. And obviously, technology needs to be regulated. You have different regulatory bodies. Oftentimes, instead of going through the PMDA in Japan or the HMRC in the UK, it might make more sense to look at the FDA to get approval there so that, you know, one can scale and then come back. So then having governments that can think about what are the sort of, how do you alleviate the regulatory bottlenecks so that solutions can scale in their countries, and how do you produce a pathway for adoption so that it has maximal impact to the people of that country becomes really, really important. And I think there are moves towards this, and Japan, I think, is taking a more sort of innovation-friendly regulation stance, and I think that is a positive move. Yeah, I'd like to see how this evolves in the future.
Thanks, Kengo. And just building on that, and that, I suppose that more innovation-friendly stance that you referenced, we often hear that Japan is more comfortable, and Japanese people are perhaps more comfortable with robotics and automation than the UK is. From your perspective, is that a true characterization? And if it is, what makes it the case?
Yeah, I do think it's generally the case. I don't know how many of you have been to Japan recently, but on my last visit to Japan, I walked into a restaurant with a couple of friends, and I was really astonished to see that drinks and food was delivered on these little robo-servers, and you would click when you picked up the food. And what was astonishing to me was actually how seamless this was. I felt embarrassed to want to take a video to share because, you know, the families around me, the kids around just seemed to think that this was a usual scene. And I think it isn't something that you see too much in the UK or in Europe. So I think in that sense, it is something that is pretty present in society there. I also think that from a cultural perspective, when I think in my Japanese mind and think of the term robot, I imagine something quite different to sort of my more Western mind, is in that I think of like cartoons, robots. I don't know if some of you know Doraemon, which I grew up with. It's this blue mouse robot-like a creature, but it's a companion to humans. It is there giving tools that humans don't have, and it really is sort of a friendly entity to humans. And I think there are a couple other examples like that in Japan. And maybe this is a generalization, but when I think of the word robot in English, I think more Terminator, Ex Machina. Some threat-like entity springs to mind first. I think that this is an advantage to Japan. Culturally, I think it's been integrated in how we interact with media and popular culture. So I think that's really good, and obviously aligned with Japan's vision of more technologically advanced society 5.0, which I think very aligned, and there is a strong digital foundation. So I think that's very much aligned. Yeah.
Thank you. And I guess say a little bit more about Society 5.0, and does having a national narrative about technology materially shape public acceptance, do you think?
I think it goes both ways. Having a national priority is important, and I think the people will follow that. But obviously, I think there is a bottom-up move of having this in the culture and people being used to it, that it becomes much easier to take in and want to adopt.
Thank you, Kengo. So we've talked a bit about kind of the theory and the way that tech is adopted, the way tech's having an impact. And I guess, Ben, you've already told me about an example from your own work of a kind of really practical way that AI is being deployed. But what I'd quite like to do now is to kind of continue that practical focus, ask you each to tell me about a high impact use case for AI or technology that you are excited about from your sectors, and perhaps, Ben, if you could take one that's not one that you are deploying day to day, but maybe one you're thinking about. And tell me how you think that will change the sector over the coming years.
So I think not one that we're using in current form, but I think, as Kengo mentioned, I think robotics will play a significant role in the future of care, because the demands for care given an aging population are only increasing. Even now, 1 million people in this country need care but are not receiving it. And to your point, you said, I think 1 in 11 employees will work for the NHS potentially, right? I don't know if the medical schools and nursing schools are going to keep up with that, but that presents a growing gap between the demand versus the availability of staff. And I think that AI, but in a more physical sense, robotics equipped with it, will have a material impact on the way in which healthcare is delivered as we fast forward 5 years. The pace of change now has really stepped up, and given that many people in society are somewhat used to using AI on a day-to-day basis, I think there will be a extension of that into robotics. So it won't just be Japan or a few other countries that are leading the way with that. I think it will become much more present in Europe, the US, and some other countries and continents as well.
Thank you, Ben. Barbara.
Yeah, so there's this example that comes from my own country, Italy, which is a project that I was supporting in my previous capacity in terms of advisory work, which is the largest Italian agency that provides social benefits, serving 50 million Italians, providing benefits on unemployment, to vulnerable people, pension-related benefits. Wanted to use AI to improve the delivery of to improve their capacity to solve a problem which was linked to the non-uptake of social benefits. Again, this is an agency that provides benefits to the vulnerable people across the whole Italian society, 50 million people. So they're like, can you help us use AI to solve this problem, which means reaching more of the people who are actually entitled to get the benefits. They didn't know if it was a problem with corruption, if it was a problem with their incapacity to identify the beneficiaries. So they're implementing at the moment the project. They're trying to use AI to solve this issue, and I think it's a big it's a project that potentially has big impact, because if you help the vulnerable people, for example, if you help people who provide social care to elderly, you improve the life of 2 people the vulnerable person and the person who's helping the vulnerable person. So it's a very small, if you think about it, it's not a groundbreaking project, but it helps solving some of the typical problems of any public sector, which is, the limitation of being able to connect technology with the delivery of a better service at the end. And, cutting internal bureaucracy or solving problems like in this case, which were linked to data. They didn't have the data concerning, the potential beneficiaries of that benefits. So I think that's a very simple project that can show that the very simple use of AI can provide better services at the end.
Thank you, Barbara.
Yeah, I would say that given that there will be a massive strain, as we've discussed, on the healthcare system, a move towards a more preventative healthcare rather than a reactive healthcare will be necessary. And I think AI has a really big role to play in that, both in predicting outcomes, but also in then tracking, monitoring, and being able to intervene in the sort of best time possible. And for that, I think what we can do is bring all sorts of multimodal data. In the research that I was doing in dementia and neurodegeneration, what we can do is actually take in voice data, gait data, metrics from cognitive tests, amongst all sorts of other variables, and treat these to figure out what is going on. Are things declining? What are the drugs that are working best? These are things that are really hard to do in its current state, but with better quality data, gathered in the right way and with the right types of models, in this case, machine learning, AI, whatever we like to call them, I think will really revolutionize how we deal with these chronic, degenerative disorders. And I'm excited to see, how in 10 years' time we're dealing with these problems.
Thank you, Kengo. And I think one thing that's an interesting theme across all of the examples you picked is this impact, the kind of real visible impact for people, right? You know what I mean? That there's a potential for, clearly all of us are using ChatGPT or whatever our chosen LLM is, but this ability to move from AI in the background to kind of AI, technology, robotics being something that people are in touch with and experiencing day to day, and it's improving the services that they receive. We touched briefly before on regulation, and clearly it's imperative that as whenever we're making change, whether it's about AI or anything else, that we maintain public trust, that we have regulation that is robust and keeps people safe. But I think at the moment we are searching for the right balance, perhaps, between speed and assurance. And I'd love to hear your thoughts on what that right balance is and how we can get there, how we can demand the right level of evidence for AI and technology adoption, but not go so far that it's impossible for the bar ever to be reached. So, Ben, I wondered if I could ask your opinions on that first.
So what I would say is first, in health and care, technology adoption has typically lagged behind other sectors, which in some ways is unfortunate, but the silver lining is it does give more time for regulators and policymakers to evaluate technologies and determine how they can be best used, and to develop the relevant frameworks. And I think it is, when it comes to AI, about frameworks and guardrails, so that providers, technology companies, hospitals, they understand the remit within which they can use AI, and when specifically they need to go through quite formal evaluations versus they don't. Because some forms of AI, which are getting adopted now, focus on what could be seen as a bit boring items in healthcare, like invoicing, contracts, admin, scheduling. But actually, by digitizing and automating and using AI for those relatively boring parts of healthcare, it frees staff to focus more on really important priorities such as quality, or recruiting and retaining staff to help solve that staffing challenge. But with those more boring use cases, regulation doesn't need to be necessarily as interventional in healthcare. However, as we move much closer to the patient and it affects a patient's outcomes and the type of care that they're delivering, absolutely we need a high degree of scrutiny, and definitely in initial years, human supervision for how some of these tools are being used.
Thank you. I think that's a very comprehensive answer, Ben. And I guess there is this point about and we may not have time to debate this today, but kind of where is the right point for AI to operate under human supervision? In the future, will there be a place where it operates autonomously in some cases, but obviously taking account of those different levels of risk in different settings? Barbara Kengo, is there anything that you'd like to say on the regulation?
Yeah, very interesting, because I've been for over 16 years at the OECD within the Public Governance Directorate that was also looking after regulation. So I'll take your question from regulating AI perspective, or regulating digital perspective. First of all, if you look at the EU AI Act, the limitation with that act is that there was an overemphasis on risks. And I think any good regulation in the age of AI needs to be able to balance risks and opportunities, so providing the safeguards, but not limiting adoption of AI, which means use, which means innovation, testing, and experimentation. The balance was not there for the EU Act. Certainly was the first piece of comprehensive regulation in place, so great piece, but I think that teaches us a lot. Second, my colleagues at the OECD would have said there is a limited clarity if the regulation is regulating who's using the technology, the use, or the technology as such. Clearly, like Ben said, the technology cannot necessarily be regulated, because the moment the regulation has been adopted, maybe the technology doesn't exist any longer in its format. And the third point, I think, the Danes a few years ago were saying a bad law today is going to be a bad code tomorrow, meaning regulators need to be trained. Oftentimes, regulators do not have the skills, capacity, and understanding of technology. So I think there's a lot of space there to have like a better way to form the regulators, so that the regulations we have in place provide that balance without limiting the application of AI or any upcoming tech.
Thank you, Barbara.
Maybe just to add to that, I do think, I mean, we have been focusing on regulation here, but there is also beyond that, when we do regulate and have solutions, I think it matters that these tools work really well.
Yep.
And I think that's actually what's more important. And when we talk about public trust, I think as soon as we have AI tools that work really well, that we've kind of thought about the risks, we can minimize false positives, minimize false negatives, and have trusted systems that are clearly better than human decision making. I think these are the tools that will be used, and we need regulation that will help, get these tools to that level. And as soon as we get there, I think we will have new solutions that will be really useful.
Thank you, Kengo. I'm going to ask one more question before we move to questions from the audience, both online and in the room. So please do think about questions you might have to ask the panel. We'll have about 15 minutes for that. But the final question I'm going to ask is that, I guess we've heard, obviously with some caveats, a lot of positivity about the difference that AI, robotics, other elements of technology can make to elderly care and looking after older people over the next 10 years. What would it take to get there? So we've said some of these things already, but I'd like just from each of you to hear a few sentences about, from governments, from the private sector, from others, from investors potentially, what do we need to do to get to that point, to get the maximum benefit from this technology as it continues to advance? Ben, again, do you want to go first?
Yes, okay. From the government side, I think I talked about regulation and reimbursement and reflecting on that so that it captures the value AI can create and encourages providers to do it. I think from a healthcare organization perspective, it is actually leaning into AI and technology. Many people I meet from the care sector or broader healthcare have been managing care in a particular way for the past 30 years, and that is their intention for the next 5-10 years or however long they want to stay in the sector. And I think in the same way that in medicine there is a duty to use the most appropriate medication or drug if someone has a condition, I think having a similar culture around technology and AI tools, which potentially could have an equivalent impact and benefit for patients, and distilling that in culture is going to be really important. I think ultimately in healthcare, frontline adoption is what will drive the broader spread and use of AI, because if staff, whether it's carers, nurses, doctors, physios or others, are using it, patients in turn will use it as well. Providers and payers will start to come on board too. But I think if I had to pick one stakeholder in the whole ecosystem, it's frontline staff, and how do we empower them to better adopt AI and lead that charge.
Thank you, Ben. Kengo, do you want to jump in next?
Yeah, I think obviously there are many players, including frontline staff. I think from a government perspective, there needs to be prioritization of these tools to be implemented. But I would also say that there are so many players in this, and they all need to start moving so that an ecosystem can be built that is promoting this sort of technology. So this will be governments, policymakers, but also founders, investors, and also all sorts of other ecosystem players that are involved. And all of them having a direction of building a rich and exciting ecosystem that are solving for problems of the aging society will naturally create this flywheel and lead to positive changes.
Thanks, Kinga. Barbara.
Yeah, it's very interesting because I would have said things that both of them said. So I'll just add a last point that I think that ecosystem needs to work together, and they needs to find ways to work together. You need the governments who create the environment where AI can be deployed and adopted. You need the healthcare providers who understand the need of the final user and can improve or increase adoption. And you need the private sector that has the technology. So definitely not only we need to nurture the ecosystem, but that ecosystem has no option but needs to be working together.
Thank you. So we're going to take questions from the audience. And I'm going to ask the room first, and then I will come to our colleagues online. So this gentleman first. Please wait for the mic, because otherwise nobody will be able to hear you online. Go for it.
Thank you so much. I'm a medical doctor specialising in musculoskeletal and sports medicine, and I'm also studying AI in healthcare at Warwick University. So this has been hugely interesting and valuable for my assignment, so thank you very much. Just a quick question on the medical side. How do we avoid automation bias with doctors, nurses, frontline health workers, that they don't become de-skilled and auditing their knowledge, so we're not over-relying on AI algorithms? And also I'm looking at the word global. So how do we ensure the AI models are trained on global data, they're representative of everybody, and how can that be expanded and extended to the globe, so not just Japan and UK?
Barbara, do you want to say something about the data point, and then I'll come to Ben on the clinical side?
Yeah, I want to say something also on the workforce that you mentioned. Like I said before, one of the key elements that made tech use in other sectors successful is remembering the importance of the workforce. So keeping investing on those people who are key to improve the delivery through AI in health is essential. On data, that's a key point. Low resource data and languages, it's a theme that is coming up and up and up. So not only on health, but in other policy domains, it's extremely important to make sure that the availability of data of good quality and digital formats needs to be available across countries and across different groups of citizens as well. So definitely it's something that needs to be tackled through a common prioritization of this in multilateral collaboration, in priorities of national policies, because definitely cannot be left in the hands of few handful governments, but it needs to be like a shared priority across nations. I think it's also a way to improve better results even in countries where there's data available in high quantities. So definitely it's a key issue that is not only limited to the health environment.
And I think on the de-skilled point, that is a risk. Genuinely is. I don't think there's a perfect solution. I think training and evaluation is very important, and maintaining that. And I think there's some benefits to AI in allowing training to be more bespoke for individuals based on their specialist interests, allowing evaluations to be more specific. The platform that they may be interacting with can determine indirectly how much knowledge that they have and how up to date they are. So those are all benefits. But taking a step back, I think the role of clinicians may also adapt and change. To being less knowledge focused and specialist knowledge, but to more, in some cases there are physical elements, surgery, sports medicine, rehabilitation, physiotherapy and so on. And it allows a given healthcare professional to potentially manage more patients than they otherwise could, and to oversee that in a greater way. And that is an adaptation of the role rather than always being on a one-on-one ratio. And given that the number of people who need care and the change in demographics and conditions is only increasing, we saw the demographic changes to Japan, there will be that pressure on healthcare professionals. How can you manage this massive waiting list more sustainably? AI can help you do that, but your role may need to adapt accordingly.
Thank you, Ben. I'm going to take one more question in the room, and then I'm going to go online. This gentleman at the front here.
Thank you. very interesting debate. I wonder if I could just try to effect a subtle frame shift. First of all, by reminding people perhaps of a certain age of the cybernetic poem written in the 60s by Richard Brautigan. I can't remember, and I won't attempt to recite the poem, but I'll remind everyone of the context. The final verse is that we're all put out to pasture and looked after forever by machines of loving grace. And so there's a danger that we kind of frame this around illness and looking after people from the age 60 and beyond as if they need to be put out to pasture and looked after by machines of loving grace. So when we talk about prediction and prevention, and when we talk also in the next breath about the collapse of the middle classes and the knowledge worker stratum as a result of the introduction of AI, and then we talk about cognitive decline as a function of no longer exercising the muscle that enables us to subsist in an environment, then we have to think in a more joined up and broader manner about the challenge we're looking at here.
Let me come first, and I want to now invite others to come in. I mean, I completely agree with the point that you've made that people over 60 are going to are contributing massively to society. Of course, we're not in a place where we're not. People online probably can't see this, but of course, I mean, it would be crazy to say anything otherwise. And what we're not talking about is some kind of model from 50, 60 years ago when kind of people are retired and I'm not going to repeat the words you said, but so a lot of this has to be about how we kind of adapt our societies, how we enable people. It's not about kind of people suddenly moving to a care home when they reach a certain age, of course, and I hope it didn't come across as that.
I was trying to make a different point, which is how do we integrate the challenge upstream from people getting sick and figure that out using machines of loving grace.
Yeah.
And I think, the NHS is meant to be a national health service, but at the moment, many people say it focuses much more on sickness. And I think that once the capacity challenges are dealt with, because right now people are treading water, if that, absolutely the focus then is more proactive about how do we encourage people to live longer, better lives in the community, to stay healthier, to support them in their neighbourhoods, and to allow them to have kind of more vibrant societal lives. That is the question that I think lots of people in healthcare would really want to focus on, but because of the overwhelming pressures, they find it difficult to do so. And so I think hopefully AI and technology is an enabler that allows us to go from that reactive to proactive when it comes to people's health and aging really well.
And I agree to your point on having a joined up approach. You make the life of elderly people better if you target their needs when they're young. So I don't think it's only here we are talking about aging population and how we can help the elderly, but I really think that the use of technology and AI can improve the quality of life even of kids that in some countries, due to malnutrition or bad nutrition, have more probability to grow up with illnesses, for example. So I really agree with you that it's not about just targeting one group, but it's thinking about how can technology and AI help improve the quality of people's life holistically. There's a very interesting book called The Invisible Woman that came up a few years ago that was showing how, going back to your joined up approach, from different policies point of view, that because policies were using data, which were representing men more than women, the result of health systems were biased towards men, and there were more women who were falling sick, were not helped as necessary because their health conditions were different. So this to say that I think this joined up approach when it comes to policy making and use of data and AI is essential to improve the health across society.
And just maybe to echo that, we haven't spoken much about healthy aging, but I think this is one key opportunity for AI in healthy aging. I think there are many tools in which we can use so that we don't 60 plus it means something very different to what it means right now.
Emma, shall we take a couple of questions from online?
Yes, thanks panelists. We've got many questions online, but I'm going to choose two. I'll read both out and then if the panel can answer them. So the first one is from Anonymous. I can absolutely see the vast potential of AI in healthcare, but do have some concerns about the proposed applications when it comes to the elderly. The idea of being quote unquote cared for by a robot when I'm elderly fills me with absolute horror. Many elderly people are lonely, and the power and importance of human contact should not be overlooked. How do we make sure that we build that in when we're designing these solutions? So that's the first question, and the second one is to Dr. Ben. You mentioned in the course of the panel the case about the UTI diagnosis. Were the people and patients who identified as susceptible informed of that diagnosis? When they were identified, what interventions took place? Who notified the GP of the problem to obtain the antibiotics needed? The questioner is asking, what is the precise role of AI in that process, in that pipeline? Thank you.
Thanks. So, thank you for those questions. Kengo, I wonder if on that first one, expanding on what you were saying earlier about kind of different perceptions of robots, of AI, what, you know, if you had something you'd like to say in response to that.
Yeah, I mean, I would begin by saying that when we speak about the potential of AI in healthcare, it isn't that all, you know, clinical, medical decision support is going to be replaced by AI or robots. And I think there are specifically now certain decisions that can be maybe made better with AI. For example, if you were analyzing CT or MRI scans to identify tumor, it's quite clear now that actually computers and computer vision can do a better job at that than a trained radiologist's eye. And in that case, I think if we have the proper safeguards in place, we can rely on AI. And I don't think many of us, if there is a higher rate of cancer being detected, we wouldn't oppose the use of AI. Now, when it comes to care and having someone by your bedside and having emotional support, I think that is where the human element is so important, and we are so far away from AI replacing that. And I think these are elements that will remain ever so important and needed in the next generations of healthcare.
Can I just add one thing on that? Going back to the example from Denmark I was mentioning earlier, and again, we're talking about more than 10 years ago, through user engagement, the Danish government had asked the elderly people that they would have been serving with robots in their houses, what was their preference? To actually be hospitalized or go in structures where they could have been assisted or stay home with the support of robots and with the complementary support of humans like nurses. And through that user engagement exercise, they had realized that the people prefer to stay home, and they would have wanted to see nurses twice a day, like in the morning and in the evening. Meaning, I think there's a way to balance, the use of robots with the presence of a human, healthcare specialist if you really engage the users, like we said until now.
Just to build on that before I know the other question, yes. I think user experience is really important when it comes to robotics. And so what we found is simply by having a screen on the front of the robot and allowing an older person to video call their loved ones through that, or care teams, has made a profound difference, because some of the people we care for, if they've suffered from a stroke or have mild dementia, they may find it difficult to use a smartphone and to have a video call. So that opportunity is not available to them. They may do a traditional phone call every once in a while, but a video call, actually seeing their loved one or seeing their grandchild, or there's one example where they saw their grandchild graduating in university, that becomes much more possible. And that improves actually the connectivity that someone could otherwise have. Now, there's a lot of things that still need to be worked on, but we've got some time I think robots at greater scale are being thought about in the care sector. To the question around where the AI is used in picking up health issues before they occur, I'll give you an analogy from another sector and then I'll apply it to the care. So I'm sure many people here use an app to manage their bank account, whether it's Monzo or HSBC or whatever. And let's say, Ned, you had one, and today there was a transaction in Thailand. Someone bought some clothes in your card. Your app may flag that, right, and say, Ned, was this you, right? And how does it do that? Given the bank probably has billions of transactions every day, it's not a person reviewing it all. So there's an algorithm that will flag that as slightly anomalous, given you're here in London, flag it to you, and then if you say, yeah, actually, this wasn't me, then it will be escalated to the frauds team and they'll do something about it. In a somewhat similar way, we're delivering, millions of visits every month in the home, and in every visit, information's collected on an app, because our carers and nurses use that to log notes on how the care has gone. And we have an algorithm that runs through all of those visits and immediately flags any that are high risk. And in some cases, it's hard for a human to spot those changes. If someone's a bit drowsy, A carer may think that maybe they need a nap, they're tired. But actually drowsiness can indicate someone has mild symptoms of an infection, even a urine infection. And it can be hard to spot those subtleties if you're a person who's visiting that person for the first time, or you haven't seen them for a couple of days. An algorithm, however, can, based on the many visits it's seen in the past, spot that atypical variation, flag it, and in our case it flags it to our operational team members and says, there might be something atypical with this visit, I think you should have a look at it and look for X, Y, Z. And then the operational team member will say, okay, I think we need to call the GP. They will contact the GP, run the situation past them, who will then remotely prescribe the antibiotics which are picked up by the carer and administered. And so that is the slot that the AI operates in, which is largely diagnostic, but its use is then human supervised.
Thank you, Ben. Thank you, everyone. Emma, do we have time for a couple more? Great. I'm just going to, there's somebody at the back. And then I'll come to you, sir. At the back, gentleman with glasses on, I think.
Hello, everyone. My name is Dinner Gandhi. I'm the principal consultant at Searchlight London. We look after the patient search and SEO for a few healthcare clients in London. One of the biggest issues we've had in the last year is patients have actually used ChatGPT to self-diagnose themselves, which is pretty common. But they're then worried that things like paracetamol is going to cause autism and other things which have been in the news cycle. So my question for the panel is, disinformation campaigns, manipulated media, policy changes in other countries, they're big global changes, but the UK and Japan maybe on a local level doesn't support those views. What's the view of, say, the Tony Blair Institute on implementing localization to some of these algorithms, regulations, LLMs, so that it stays true to the UK and Japan and isn't influenced by global factors?
Not for me.
Maybe one way I can answer this is that we did some work on how AI can be used in lower middle income countries. And one of the key aspects of this is having data from kind of the local environment that reflect the local needs. And obviously we will endorse the collection of local data so that it's not just based on large Western databases. And I think this applies also to different regions, different demographics. There will be some sort of tailoring in data so that decisions and recommendations are made based on that information. And I think this is a move that is happening, and we will continue to see sort of more personalized decisions via LLMs.
Just to complement, this goes back to what we said before about low resource languages, for example, and the need for the whole ecosystem to prioritize the increased availability of local data available in the right formats to represent in a more inclusive way the needs across society. So there's a need to prioritize this theme across governments. This is not only a matter for UK and Japan, but is, I think, relevant across the globe. So definitely there's also a need, for example, to nurture the ecosystem we were talking about before in many African countries to overcome the shortage of local data available in the right formats. There are partnerships between local academia and governments to make sure that more data is available from the local context. So definitely there's work that needs to be done also to increase the awareness of many governments on the need from their side to prioritize efforts to incentivize the availability of local data.
Thank you. And I guess just one example from my own, from the work that I do, sometimes when we talk about AI assistance for clinicians, for example, and of course, wouldn't it be wonderful to have a kind of all singing, all dancing thing, which can be like a specialist doctor in any specialty sitting over your shoulder who you can ask questions of. We may get there one day, but there is also a place where you could train an LLM, say, on the local clinical guidelines for a particular country. And that would provide clearly answers to a more limited set of questions. But wouldn't that be wonderful too, right? Because it would enable people to see the latest and act on the latest, even if they haven't had the latest training on a guideline that came out last month. And so I think there are ways of thinking about this in a stepwise way that allows sensitivity to those local situations. I think do we have time for one more? One more? Okay, so you've been waiting a long time, so why don't you need to take the mic, sir, because we need to be able to...
My name is Stefano Bonf, I'm Italian, and I would be interested to know which organization you are working in Italy. But my question is, let's say, I'm involved with, let's say, Health People, Health Planet, and we are established at Imperial College. And the concept is, I think everybody should be healthy. For example, the idea of personalized medicine. We are experimenting here in London itself between, what are the issue why the health sector, it's not functioning properly? Why don't take history about how you do more research? For instance, in London could be an example, pollution and health. So many things, so the idea is, I would like to hear more on the concept of data. I'm okay, but AI will disappear. Everybody know quantum computing is coming, and this quantum computing will revolutionize again and again and again this framework of, let's say, health. The idea of global institute for change, that's correct. Have data at the center is correct. The issue is how we build this global, health people, health planet using data. Thank you.
So I'm not sure I completely understand the question, but I'm very happy to pick up with you afterwards. I think that the panel has said a fair bit about the use of data and the ability to apply AI or other tools to data to enable us to do a number of different things. And I guess the one of those that I would pull out again in answer is the ability to keep people well, right? Because I think that, as has been pointed out in some of the other questions, is one of the biggest single goals here, right? It's not just about treating ill health, but it's about managing to square that curve so people can stay healthier for longer. And I think that while we've talked about robots helping people in people's homes and things, and those are very important, there is also a role for AI to play in helping us make those predictions and helping people make choices that enable them to continue to lead healthier lives for longer. I'm confident that doesn't completely answer your question, so perhaps I'll come and talk to you about it afterwards.
And just to clarify, the Tony Blair Institute is not working with Italy, so it's not working with that agency. In my previous capacity at the OECD, I was, and it is IMPS in Italy that you probably know quite well. If I get your question right, my answer would be with the joined up approach we were talking about before. It's not just about data, it's not just about AI, it's about, we talk about personalized healthcare, it's about a problem we are trying to solve. It's about myself having specific problems which might be different from somebody my age in the audience. So it's what problem are we trying to solve for the citizen who has the right to be provided healthcare, and how can data and technology and AI help solve that problem. So to me, only if we think about that in that comprehensive and holistic way, then we can find the best way to use AI or any other technology to help the people.
Great. Thank you. Thank you so much, everyone, for the questions. Thank you for listening. I'm going to stop us there. I guess just to say a couple of things to wrap up. I think what we've heard is that there is enormous potential from AI in this area that we've been talking about. But it's part of a set of things, right? It's not going to make a difference alone. We need a whole range of things, both to enable it and to work alongside it. We're not talking about a world in 10 years' time where we don't have doctors and nurses and care workers and everything else continuing to provide care. A couple of really important points I've heard on how it's enabled are, one, aligning an ecosystem, right? This isn't about just the private sector, just the public sector, just investors. It's about a range of different groups with different approaches, different skills, different tools coming together to make a difference. And then I think perhaps the most important theme that's come throughout is it's about people, right? You know what I mean? And it's about, in particular, two groups of people. Firstly, the people being served by these technologies and by our wider health and care systems, and secondly, the people delivering care. And we need to think about both of those groups if we're going to make any kind of difference, really, as much as we're thinking, or even more than we're thinking about the technology itself. So I will stop us there. I want to say thank you to a few people. So firstly, thank you to Japan House London for hosting us. Thank you to the caterers who we're going to benefit from the wonderful work of in a couple of minutes, and I won't stop us for long. Thank you for the staff at TBI who have been involved in organising tonight. I know a huge amount of work has gone on across all of those groups. But then finally, thank you, a huge thank you to our speakers, to Ben, to Barbara, to Kengo for joining us today and for sharing your thoughts. A round of applause, please, for them.